Hello, welcome to the guide on what to expect when you're expecting Cesarean Section Edition.
Let's meet the team you'll see in theater. We are the anesthetic team. You may have seen the anesthetist beforehand during your pre-operation appointment as they talk through your options with you. When you walk into the theater as an anesthetic ODP, it's my job to check you in. We just double check that we have the right patient, you are aware and happy with the surgery, and we have your consent. We add some monitoring on you, such as a blood pressure cuff, a SATS probe to measure your oxygen, and some ECG dots to measure your heart. We also ensure you have some funky socks or boots that ensure circulation in your feet, are aware of any and answer any final questions you may have, and ensure to ease your nerves, as it is very understandable you may be anxious. A spinal anesthetic is a common and safe form of pain relief used during a cesarean section. It involves a single injection of local anesthetic into a fluid-filled space in your lower back, called the subarachnoid space, which surrounds your spinal cord and helps carry messages between your brain and body. The injection is usually given in the lower spine, below where the spinal cord ends, and it works quickly to numb the lower half of your body. You'll still be awake, but you won't feel any pain, just some pressure or movement during the operation. You may feel your legs becoming warm, heavy, or tingly, and they'll become temporarily numb and unable to move. To make sure the anesthetic is working, we use a cold spray or a cool object on your skin, since cold and pain travel along the same nerves. Throughout it all, you are carefully monitored. Spinal anesthesia allows you to stay comfortable and alert while your baby is born, and your partner can usually stay with you throughout the procedure. Once happy with the anesthetic, you will be assisted to lay flat with a 15-degree slight tilt to the left to assist pressure from baby onto your heart.
We are the scrub team. Once again, before the surgery starts, we double-check the checks and ensure everyone is happy to go on, and we prep and drape your belly. Behind the curtain, the surgeon starts with a small horizontal cut, made low on your abdomen, usually just above the pubic area. The surgeon carefully works through several layers, including skin, fat, muscle, and the womb, to reach your baby. Once they reach the uterus, your womb, another small cut is made, and your baby is gently lifted out. You may feel some tugging or pressure at this point, but no pain. After birth, the umbilical cord is clamped and cut, but often delayed for at least a minute, which has been shown to help with your baby's iron levels, blood pressure, and overall health in the first months of life. As soon as your baby is checked and doing well, we encourage skin-to-skin contact with you. This helps your baby feel calm, regulates their breathing and temperature, and supports bonding and immunity. After your baby and the placenta are delivered, the midwife checks the placenta to make sure nothing is left behind, which helps prevent complications like heavy bleeding. The surgeon then carefully stitches each layer closed, making sure everything is secure and that all surgical instruments are accounted for. You'll then be cleaned and moved to recovery, where you can continue bonding with your baby in a calm, supportive environment.
We are the recovery team. We may pick you up in theater, or you may join us in the post-anesthetic unit, also known as the PACU. Our goal is to make sure your recovery is safe, smooth, and supported, so you can focus on your baby, your comfort, and your well-being. This is a quiet, closely monitored space where you'll be looked after as the effects of the anesthetic wear off. A dedicated recovery practitioner will stay with you to make sure you're safe, stable, and comfortable. We start by checking your vital signs: breathing, heart rate, blood pressure, and temperature. Because you had a spinal anesthetic, we'll also check how it's wearing off. This includes gently testing how much movement you have in your legs, using something called the Bromage score, and using a cold spray to see what sensation you have. These tests help make sure the anesthetic is wearing off safely. You may have been given a purple wristband in theater, and this ensures everyone is aware of your spinal anesthetic, and there is a target time it should be worn off by. This is usually around 4 hours. We must ensure you have some movement in your feet and manage any feeling of nausea. It is very common to experience nausea post-operatively after a C-section. Ensure you inform your recovery staff, and they will help manage it. Having the spinal anesthetic should help act as an extra pain management post-operatively, And the practitioner also ensures there is no excess bleeding on your wound dressing or maternity pad placed underneath you. It is crucial the practitioner monitors any excess bleeding for your safety. Once you're fully recovered, you'll be transferred to the postnatal ward, where you can continue resting, bonding with your baby, and begin your recovery journey with support from the midwifery team.
A cesarean section is a team effort, and we're here to make sure you and your baby are safe, supported, and cared for throughout the whole experience.